Here in Stamford. This is Mayor Martin here. Tonight we're going to give a quick update about the vaccines which we have started administering in Stamford this last week. We're going to have the Director of Communication for the state's Chief Operating Officer, Laura Ray Anderson, is going to talk about this COVID-19 mobile app, which some of you may have, but she's going to give you more information about that. Then I'll go through the usual statistics. And then finally, we're going to have a couple of pages from Thomas Madden about the federal stimulus package. As we come up to the new year, we're going to have our Director of Public Safety talk about enforcement actions that are happening. And as we often have, Special Assistant Laura Berwick will give us an update about the testing sites and then a quick conclusion from me. So we will proceed. First of all, and from the vaccination, Stamford Health, many of you know as Stamford Hospital, is primarily responsible for vaccinating their own employees. They are using the Pfizer vaccine, and so far, as of today, there have been 1,800 healthcare workers at Stamford Health have been vaccinated, and they will be getting their second shot in about 3 weeks. I should point out that they're not immune until after at least the second shot. So even if they've had the vaccine yesterday or last week, their immunity really hasn't built up until at least 3 or 4 weeks when they get that second shot, and even then it may not be up to full potential. So even if you've had the shot, that doesn't mean you're immune just yet. Still have to be careful. Here at the Stamford Department of Health, we are vaccinating our own first responders. 350 responders as of this week. We started last week just before Christmas on Wednesday, and we vaccinated more. We are administering the Moderna vaccine. The Pfizer vaccine requires extremely cold temperatures, and the Stamford Hospital has the capability of keeping it cold, whereas the Moderna vaccine, although it has to be kept down at 0 degrees, that is not quite as difficult as what the Pfizer requires. And finally, the nursing homes are also in this first round. January 6th is when we understand the vaccinations will begin in Stamford nursing homes. CVS and Walgreens are administering the vaccine to the nursing homes. So we actually have 3 different groups: the Stamford Department of Health, the Stamford Health systems, and the Stamford nursing homes through CVS and Walgreens. And I can tell you that I'm extremely pleased that we are starting these vaccines. Science is actually helping us to find the way out of this terrible, terrible pandemic, and so we start. With that, though, what I wanted to do next was turn to Laura Ray, who's here waiting. Let's see, last time I used her name wrong, so this time I'll get it right. Laura Ray, thank you. And why don't you go ahead and begin?
It's so good to be here, and Mayor, I'm flattered to be mistaken for Laura Jordan any day. So thank you. No worries in the slightest. And I want to say thank you for giving an overview of the vaccine. I wouldn't be using this opportunity appropriately if I didn't say here at the state, we're so incredibly hopeful. And the vaccine coming at this time of year, it really means a lot to us. I know it's a time of year where we're not seeing our loved ones in the same way that we're used to, but it's also really a season of hope. And we've got the vaccine. Of course, there's limited supply. We're rolling this out in a really methodical way, but we are headed in the right direction. And we do know that there is light at the end of the tunnel and that we are hopefully turning a corner. But as you said, it's always important to know that just because people are getting the vaccine doesn't mean you can stop wearing the mask, doesn't mean you can stop distancing, doesn't mean you can stop washing your hands, which hopefully you never do. It doesn't mean you can't stop staying home when you think you might be sick. But if you have to go out, if you have to go to the grocery store, if you have to meet some friends for some reason, we do also have a great phone app that can help you and help those around you that I'm here to talk a little bit about. It's called COVID Alert CT, and what it does is it helps you find out if somebody near you who also has the app tested positive for COVID-19, and that person and you can both anonymously report if you've tested positive. And I'll reiterate that a couple times throughout my talk. it's anonymous. So if, for example, you get a notification that someone near you has tested positive for COVID-19 and you're curious about why a contact tracer hasn't called you yet, it's because it's anonymous. They don't know your information. So I'll talk a little bit about what the process looks like in a little while, but I want to just stress it's anonymous and it's safe, it's easy. Your information will be protected and your location will never be tracked, as it says. So there's, an important difference there. We use Bluetooth technology in this app. We don't use your GPS. So there's nobody from Apple, nobody from Google, nobody from the State Department of Public Health, accessing your information and taking a look at where you are or who you are. So it's all a pretty easy and safe process. So we can go to the next slide and I'll talk a little bit more about the details. So I'm happy to report that the state is doing incredibly well. Actually, a larger percent of our population has enabled this app on their phone than any other state in the country. As of about 2 o'clock today, there are 971,000 people in the state of Connecticut that have enabled this app on their phone. So we're edging up to that third of the population. And what's great about this is that Apple and Google have said you start to see those public health benefits once you hit about 15% of your population. We're obviously above that. So not only are you helping yourself if you download the app and helping others by encouraging them to download the app, but you're also downloading something that is already effective based on the numbers that we have in this state. And I know not everybody loves living closer together, but we live closer together. We have a lot more interaction. So there's a chance that this app works better here than somewhere, say, like in Wyoming or Montana. And I know we'd love to be far away from some of our neighbors right now because of COVID-19, but being nearer to each other helps this app work. So this is a great, great effective place for you to be downloading COVID Alert CT. Just a quick note on iPhone versus Android. So if you have an Android phone, you'll go into the Google Play Store, look for COVID Alert CT, and download it onto your phone and follow the instructions. Process we're all familiar with. If you have an iPhone, Apple is kind enough to have all of these settings built right into your phone. So if you have an iOS, I believe it's 13.9 or above, you have to go into your settings and enable the app, enable exposure notifications on your phone. So that process looks a little different. And that's outlined on our website, ct.gov/COVID-alert-CT. So you can get instructions there just in case you get a little tripped up, but we're hearing it is pretty easy. And I'm hoping that if you have a phone that has this enabled, that you got a text notification early on in this process. And if you thought it was spam, which I'm a former employee of the Department of Consumer Protection, so I do of course appreciate that. It wasn't spam, so you can go in and do that notification update there. I wanted to let everybody know this is available in multiple languages. We are in Spanish, Polish, Portuguese. We're also in Haitian Creole, Bengali, and Chinese. So we have information on our webpage that's been translated, not Google translated, into all of those languages that you can find to share with your community, share with your friends, and share with your neighbors. I did want to say the only caveat to that is on iPhone, we don't have the app enabled, unfortunately, in Haitian Creole or Bengali. That's just a feature that iPhone doesn't have in their settings yet. So call your local iPhone representative and also thank them for their help, but say you'd appreciate if we got this in Bengali and Haitian Creole someday soon. So that's about languages. And then privacy in your information. I said this before, we don't share it. We don't have it, so we can't. And in fact, Google and Apple have a whole third-party vendor that even just scrubs this information for them. So not only do they not see it, they don't even handle the process by which they don't see it. So nobody at Apple, nobody at Google, nobody at the Department of Public Health. And then last I want to mention that this app works with other states. The key reason that you'll enable the app for Connecticut on your phone is that if you get an exposure notification, you're going to be directed to call a Connecticut contact tracer because they can give you Connecticut resources and Connecticut-based information. But if you go to another state, say New York, which doesn't have the highest percentage of downloads in the country, but has the most people downloading in the country, so they're here to support you too, they'll be able to exchange these sort of notifications with your phone if you're down there. So if somebody reports that they tested positive in New York, you'll get a notification if you were near them, but you'll get prompted to call the contact tracing team in Connecticut. So that's something important to know, that these applications, while not available in every state just yet, do work together. And again, ct.gov/COVID-alert-CT. Next slide, I want to talk a little bit about the process on a little bit of a deeper level. So I'm sure that some of you know that when we say keep a distance, there's a really specific definition from the CDC there. So if you spend more than 15 minutes within 6 feet of someone within a 24-hour period, and you both have the app, what will happen is these anonymous Bluetooth tokens will exchange between your phones, so that your phone will say, oh, I was near this phone for a certain period of time. And they'll remember that for 14 days. If that person tests positive for COVID-19, what will happen is a contact tracer will give them a code. They can upload that code into the app, and then everybody that's exchanged tokens within that period of time will get an alert that says, hey, you may have been near somebody who tested positive for COVID-19. And what's important here is it won't tell you who they are. You probably know a contact tracer will encourage that person to give you a call, to shoot you a text, and let you know that, hey, I've tested positive for COVID-19. You might want to go get tested, or contact tracing team, right? But this way, you won't know. You'll just get that notification that says you should call a contact tracer, and then a contact tracer will give you information about self-isolation, about quarantine, and if you're somebody that needs support getting food, if you have income support that you require in order to stay home, that contact tracer can connect you with a community resource coordinator and other community-based organizations that can help you get what you need. And then, of course, if you subsequently test positive, the process would start again with your contacts. So important things to know here is that, one, anonymous, and two, the contact tracing program in conjunction with this app, which is separate, don't exist to question you. They don't exist to track you down. They exist to get you the resources that you need to keep yourself, your family, and your community healthy. So we want to make sure that you have access to food, that you have access to income support, that if you're reading some of the self-isolation and quarantine guidance and you're not sure about the 14 days or the 10 days or the 7 days or just exactly what to do, that you can talk to a public health professional who can let you know how to do that. So it's critical that you talk to these contact tracers, and this app is an important way and an easy way to make that connection should you need it. So any questions, ct.gov/COVID-alert-CT. The more people that download it, the better that it works, and it's really a good tool to connect you with what you need. So anyway, it's good to be back here. It's always great to be with folks in Stamford, even though I'm up in Enfield. I normally enjoy the drive, so it's sad I had to miss that, but it's really great to be here. Thank you, Mayor, so much for having me, and thank you, everyone, for everything that you're doing.
Laura, I just want to ask a question here.
Sure.
So I get this app, I enable it on iPhone, or I download it from Google, and then I don't have to do anything. But if a positive test is recorded and I'm the person that's positive, or somebody else, if I get a positive test, then someone will call me and they'll probably ask, do you have a cell phone with this app on? And then you have to do something on your cell phone and they'll tell us. Did I get that right?
Absolutely. So what will happen is when you test positive, you'll get a call from a contact tracer, which of course we encourage you to answer, or if you test positive, and we hope you don't. But you'll get that call. They'll ask you, do you have this app on your phone? If you don't, they'll give you information about how to download it. And what they'll do if you have that app on your phone is they'll generate a code for you. You'll log into your app and type in that verification code, and that's what triggers other folks getting that notification. And the thing that I think is critical about this is that we don't always know who are around. So even if you do everything right, you go out to eat, you sit in a booth with someone behind you, there's plexiglass between you, but if that person gets up for 1 second and they don't have their mask on, you don't know who they are. If you can track COVID-19 from that person, but you both have the app, that's a time where you'd get a notification, and you wouldn't have known otherwise because that person doesn't know you. They don't know who you are. So there are some really nice opportunities here for you to feel a little bit more comfortable about going out into the world when you have to.
Okay, thank you very much. I get it. You download the app or you turn it on with iPhone, and then you don't have to do anything unless you get a call because you've tested positive, and then they'll go to the next step. So otherwise, you don't have to worry about it. Thank you very much.
It's easy. Just turn it on.
It's good when there's a lot of technology in the background, but it turns out it's very simple. All
Yeah.
right. Thank you very much for being with us today.
Thank you.
So I'm turning now to the usual statistic update about what's going on in Connecticut and what's going on in the state. This is last Thursdays. Every Thursday night, the state shows a map of which communities are still in the red zone, which is 15 or more cases per 100,000. And as you can see, this last Thursday, which was basically, I think, Christmas Eve, we had basically the whole state was red. This little map in the left shows that it really hadn't changed. We still have a state that's entirely red for all practical purposes. As of Monday night, the data for the state in terms of Connecticut new cases per day, starting all the way back from the spring, and you see this low, and then it's surged here so that this second wave, which has actually two peaks, surged up again. Now it dropped back down. The part of this surge is Thanksgiving. This is the post-Thanksgiving surge, which everyone should be mindful of because we're all concerned that we're going to have a post-New Year's surge or post-Christmas surge. It dropped back down, but now we're beginning to see a little bit of rise of cases. And just about 15 minutes ago, the state put out additional numbers as of today, and this number continues to climb just a little bit. In this last week, there have been, unfortunately, 228 fatalities in the state. For Stamford, this is our overall trend line in cumulative cases. You can see how we started out going up a very steep curve. We flattened the curve, as they said, so that during May, June, August, July, August, September, and even into early October, we had a very gentle rise, but in late October, this line started climbing, as you can see. We've kind of been going on a straight, very big acceleration of more cases during this whole period, which is certainly disappointing to us all. Excuse me. This is actually the cases per day. And as you can see, here's our post-Thanksgiving surge. We drop back down, but we are climbing again. The new cases, as of last night, 87 cases per day is what we've been averaging for the last 7 days. And 6 fatalities in the last week. And the report that just came out added another fatality added to the data statistics. We lost another one. And it's saddening. This is the Thursday report that they put out for all communities showing what the state is calculating for the 7-day average and the 14-day average. They're excluding the nursing homes, and basically these red bars are their calculation and the blue and orange are ours. But the key point is that people might say, oh look, it's coming down a bit. Well, the blue line's going back up, the 14 days going down. This red bar here was higher than this one. Gee, isn't that great? Here's the problem. This is the line that demarks the red zone from everything else. We were actually, and not just the red zone, but here's what the goal really was, is to stay under 5 new cases per 100,000. And during the months of June and July and August and even September and October, as you can see here, we were floating around that. We actually had numbers down in the 3 or 4 cases per 100,000. Now we're doing 64. That's 20. That's 12 to 20 times higher. That's an enormous thing. We got a long way to go to turn this curve around. And as I've shown you before, coronavirus is everywhere in Stamford. This is November 22nd to December 19th. Cases have dropped a little bit over this time frame, but not really very much. Just know that coronavirus is everywhere. It is worse in these high density areas on the east side and west side of the city, but it is everywhere. No matter where you are, coronavirus is out there. We are also tracking our wastewater. This is our most recent data. The peak that we were seeing has come down, and it is basically tending to come down, although the last report, which I think was on Sunday, shows us going sort of flat or sideways, which would be consistent with our cases are going flat or sideways. I would really like to see this number go down and crash on down to the bottom like it was in August or September. Let's hope that starts to happen soon. This is the state current hospitalizations from September on, and you can see that there was a little bit of dip there after Thanksgiving, but it started rising, another gentle rise in hospitalizations. And there are a lot of people here. That's, how many is that? That's almost 1,200 people are in the hospitals across Connecticut. We're not that big a state. 1,200 people in the hospital to COVID, and that's pretty serious. When we look at hospitalizations in Fairfield County, more specific to where we are, we basically came down a little bit more than the state did in terms of this blue curve line, but we are beginning to inch back up on our 7-day moving average. The same thing is happening here in the Stamford Hospital. The daily COVID patients climbed up. It sort of dropped down, but we've had a little bit here right at the end. At least we're not going up a lot. There are 36 COVID patients at Stamford Hospital as of, I believe, today or last night. And in the ICU, we have 6 COVID patients in the ICU, and it's similar curve. We had very little in October with a rise in November, and we don't seem to be able to shake this off. It is sticking with us, and we still have people in the ICU. We need to stop this virus. You do not want to end up in the hospital with a COVID situation. I must say, though, that the hospital is doing everything and doing a great job of keeping all patients safe while they're in the hospital. So if you have another medical emergency or a medical need, please go to the hospital no matter what it is. And with that, I'm going to turn it to Thomas Madden to talk a little bit about the federal stimulus relief package. As you probably know, President Trump signed this into law just over the weekend. This is, in my opinion, a very important move forward. There are still some issues. One is that they're still debating in Washington whether or not the personal number should be increased from $600 to a larger number. And secondly, there's still an issue about whether or not states and counties and municipalities will receive funding from a stimulus, which I can assure you is desperately needed, not just here in Stamford and in the state, but around the nation. But Thomas Madden, please take it away.
Great, thank you so much, Mayor. Great background as always. So as the mayor said, right now the House did pass a $2,000 check for people as opposed to the $600 that was recently passed. That is over at the Senate right now, and they're debating that. Because of the week delay, we have a $300 per week additional unemployment benefit, but because of the week delay, some people may only get 10 weeks as opposed to the 11 that was passed. We did see some emergency federal residential programming to the tune of $25 billion. That's going to come out to the state and to the local governments to basically help out with the rental assistance programs that we have through each of the different cities. As well, we did see an extension of the moratorium on evictions till January 31st. We are hoping that will go a little bit further as we move into the January 31st with the new Congress. There is also $13 billion for Supplemental Nutritional Assistance Program. That's the SNAP program. And again, I think as you heard earlier from Laura, we do have things set up here in the city of Stamford that if you do come down with COVID, you can contact the city. We have services available to get you food and to help set you up. Other relief that was out there right now is another $68 billion just to purchase and distribute the COVID-19 vaccines. You may have seen the numbers. They were expecting to do about 21 million people by start of the New Year's, but we're sitting around just over 2 million people right now. So we're hoping to be able to use some of that money to speed up the inoculation of everybody. Lastly, they put in there just as one of the little catch-all was just in terms of the surprise medical billing. Part of what people have been finding is that some of the stuff that was not covered under their insurance. So as you go into the hospital, they want to make sure that you're actually getting a true and honest estimate of what it's going to cost for any type of treatment. Next slide, sir. So the big one is the small business relief, and that's the $284 billion. What's interesting with this one is they put a few more caveats on this one, and it allows businesses with 300 or fewer employees that have experienced a loss of 25% in the first, second, or third quarter of 2020. You may have heard the stories of the large corporations that were getting some of the money out there and that really didn't need it, and it was taken away from our businesses on Main Street. So they did tighten that up a little bit on that, which is great. There's fully deductible for business expenses paid with PPP under the new taxes. What's really interesting with this one is they put in $15 billion, which is reserved for live venues and independent movie theaters and cultural institutions. The first round should be going out within the next 10 days. They're just finalizing the applications. The City of Stamford submitted some comments on that just to help out with our local venues here. And those are businesses that have had 90% losses. So if you think of the movie theaters, some of the local movie theaters, things like that, they're going to be eligible first to get some of that money. There's also $10 billion for child care centers to provide safely to make sure that they're open. And lastly there's a set of temporary commercial bankruptcy provisions to help commercial landlords, tenants, particularly small businesses, that give them more time to defer the rent. And so that this is just, again, stretching out a little bit. So as we get the economy rolling along here, as we get more people inoculated and we get people back into buying, this is just sort of stretching out their leave to allow them to start paying things back. I believe next week, Mayor, we're going to be talking a little bit more on this, and I'll go through a little bit more in detail than what we're just doing tonight. But I'm looking forward to explaining that to all our businesses and all to all our residents.
I understand that we don't yet have all the applications, the application forms and the procedures which the state has to approve. They're not yet set up for some of these small business relief, but hopefully that will be coming soon.
Within the next 10 days, we expect the applications to get finished up here. They are using the Paycheck Protection Program applications that were there before, but just modifying them a little bit with the new caveats that were passed in this bill. We do have webinars that are available, so if you have signed up for our economic development newsletter, we've been sending out there's a list of webinars that are going to go over some of the new PPP changes, as well as some of the application changes that SBA is expected to put into these applications.
Okay, thank you very much, Thomas.
Thank you, sir.
And now we're going to turn to Ted Jankowski, our Director of Public Safety. Hey, we're coming up to New Year's, and sometimes things get a little crazy on New Year's. We can't afford, from a health standpoint, to get crazy this year. Ted, what's going on with enforcement?
Thank you, Mayor. If you can, please change the slide. All right. First of all, I just want to I hope everybody's enjoying the holidays, but they're enjoying them safely. We are out there enforcing. We are out there inspecting different types of businesses. And the businesses that we are out there inspecting are restaurants and bars, commercial businesses such as auto parts stores, mattress stores, shoe repairs, dry cleaners, retail department stores, food and grocery stores, senior housing, fitness centers and gyms, pharmacies, laundromats, liquor stores, banks, etc. So it is a team approach to enforcement. We are using our citation officers, where we do have 3. We are using our health department inspectors, and we are using the Stamford Police Department. So that team approach really works well because they are out there blitzing, especially in certain times of the year during this holiday and certain days of the week where we are seeing more motion out there, more people frequenting businesses, more people out there seeing people who they normally wouldn't see. But we also are out there enforcing complaints. Most of the complaints that we're seeing are for lack of social distancing, lack of proper mask usage, and then we do receive calls for possible overcrowding at different locations. Within the past 2 to 3 months, we've had 400 focused COVID-19 inspections and investigations out there. And again, most of the times they are related to people not wearing their masks properly, lack of social distancing, but we are seeing a lot of compliance out there by the businesses. We see over a 95% compliance rate out there, but what we are seeing is the patrons who are frequenting businesses, they are not in compliance as much as they should be. I would say 3% of the warnings that are out there given are related to improper mask usage, and again, that lack of social distancing. So when you're out there frequenting Stamford businesses, please make sure that you wear your mask properly. Please make sure that you are providing for appropriate social distancing of 6 foot or more, and please sanitize your hands as much as possible. It's for your protection. It's for the protection of our businesses, which currently I think we all know are struggling. But enforcement encompasses 3 different areas. Warnings, we do go out there, provide warnings. Again, it's for improper mask usage, improper social distancing. We have issued 40 written warnings, numerous verbal warnings to individuals. We have issued 4 summonses. 2 have been issued for $500 for overcrowding, and 2 have been issued for $100 for individuals not wearing a mask. We have closed down 4 businesses, and the closing down of businesses is usually for the egregious violations of the sector rules, such as overcrowding, lack of mask usage, and again, improper social distancing. As we come into the New Year's, I just want to revisit the gathering sector rules. For those of you who are going to have individuals over in the private residences, please remember that those private, social, and recreational gathering sizes indoor are capped at 10 people and outdoor it's capped at 10 people also. For those private, social, and recreational gathering sizes at commercial venues, indoor it's capped at 25 people, outdoor it's capped at 50 people. And then the restaurants. Restaurants are up to 50% capacity indoors with 6-foot spacing and or non-porous barriers and a maximum of 8 people per table. Now, I mentioned before that we do have that team approach to enforcement. We will have that group out there during the New Year celebrations. Please, again, abide by the sector rules because you can potentially be issued a fine. The fines for failing to wear a mask covering is $100. It's $250 for attending an event that exceeds the capacity limits. If you are holding an event and you're not a business and you're organizing and you're over the capacity limits, you will potentially receive a fine of $500. And then for businesses in violation of those sector rules, especially those egregious overcapacity, et cetera, the governor last month, he increased the fine to $10,000. Again, we are finishing up this holiday season. We're coming into the new year. Please make sure you wear your masks, wear them properly. Please make sure of social distancing and celebrate the holidays safely. Thank you.
Thank you, Ted. And I'll just say to everyone, you know, I occasionally go into the various retail stores or into the various restaurants to pick up dinner for me and the people and my girlfriend that I often buy dinner for her from one of our local restaurants. But I'll say that just before New Year's, I was stopping in at a couple of stores and I saw some people, and they were friends of mine as far as I'm concerned, and good people, but they weren't wearing their mask properly, and I don't think I offended them, but you know, they're making it unsafe for everyone in that store. And so I, in fact, you know, said, hey, you know, please, come on, please put the mask up over your nose like you're supposed to. I encourage everyone to say that. And yes, it might offend some people, but I don't think it will offend very many. And the risk of someone getting seriously ill because of it, it just isn't worth it. The second thing I'll say is I really have no interest in chasing around and handing out fines to people who are going to events. And we may issue fines for that. But if you're organizing an event, I've made it clear to the Director of Public Safety and to our people, if there are people organizing events that are greater than 10 people for private residences or organizing events with more than 25 people for businesses, we're going to issue the maximum fine available. That's just unsafe, and that is something that we cannot abide by. It is unsafe for everyone there. And I will tell you, and this is a sad note, but someone that I know, wasn't a close friend. We didn't, you know, share beers together or anything, but I'd seen him at multiple events around the city. He was a regular guy. He was a good guy. And over Thanksgiving, he was together with his family. And unfortunately, most of the family even, you know, came down with coronavirus, and he passed away last week. And I think we lost another good man, and my heart goes out to his family for this loss. Let's not repeat that for anybody else as we come up on this holiday period. Let's all do what we can to keep everybody else safety. And if we are really concerned about everyone's health and are concerned about their health and your love with them, then you will do what's necessary to keep yourself safe as well as them safe. Wear the mask, etc. But with that, I wanted to turn to testing. Our testing numbers are way up compared to what they were in August or September, and there is more coming online as we speak. And so I would ask Laura Berwick to share with us more information about the testing here as we turn the leaf into the new year. Laura?
Hello, I am from my virtual testing site tonight. I wanted to turn everyone's attention to the map. And as you notice, the dots on the map are the testing sites. And I think we have a large number of testing sites here in Stamford. They are all on our webpage, www.stamfordct.gov/COVID-testing. And we do keep that up to date, so I would encourage everyone to check it. We've also been adding something that we call pop-up testing locations. Those are there for a short burst of time. And we are using them to sort of supplement the regular testing sites, which sometimes get a little bit crowded. I would highly encourage you to try some of these sites. The lines tend to move quickly, and it does take some of the strain off of the existing testing sites. We have going on as we speak some testing at Stamford High School. Those have been fairly regular and will be through January, on Sundays from 10 to 2 and Tuesday evenings from 4 to 7 p.m. And we recently added some testing at West Hill High School, and those are on Mondays and Wednesdays. And we have them for the next 2 weeks while the school is in a virtual session. And we also are opening up a testing site at the Stamford Fire headquarters on Main Street, and those will be Fridays from 10 a.m. to 1 p.m. And we are looking for, some of the testing sites are starting to do some pre-registration, which will also move you through faster. So again, please check our website and we will put the links to the registration. Mayor, if you can flip to the next slide, please. That is, again, an advertisement for our testing site. And the final slide, I just wanted to show people on the final slide, if you let me do it tonight, and I'll switch back to you. On the left here, this is the front of our website. You can see where it's circled on the left, the COVID-19 information. If you click there, it will also take you to that website. And then I also would encourage everybody on the right in the green circle to sign up on the e-subscriber. Our communications department has done an excellent job of putting out a weekly newsletter of everything going on. And they also make you aware of new testing sites and pop-ups that are available for your use. Thank you, Mayor. I'll turn it back to you.
Thank you, Laura. And I want to emphasize this. I haven't been selling this enough. If you want updates about what's going on in the city of Stamford, the press releases and important the weekly newsletter, there's a lot of information there that can get sent to you, but you have to sign up. And that email will not be shared with everybody to take advantage of that. We are very careful to try not to abuse that email that you might share with us. So as we come to the end, New Year's is coming. And we're all excited because I think that there have been a couple of good things in 2020, but I think most people would agree this is one of the worst years that we've had in a long, long time, with many challenges both nationally and locally that range from coronavirus to a local drought to the budget challenges that we face in the city and the economy and people unemployed. It's been a very rough year. But having said that, COVID-19 is still here. It's still a concern, and although vaccines are starting, they're not immune for several weeks until after they get their second shot. And even so, we've got a city of 130,000, and so far, we've done less than 2% of the people. It's going to take a substantial amount of time to get around to that second shot. It's going to take a substantial amount of time before we get to our teachers and then on to the general population. It's going to take time before we can get through the people that are 75 years and older and those with comorbidities. It's going to take time. And even though we are hopeful that the pipeline will get filled up with vaccine and we'll get through this earlier, there can always be glitches and overpromises. Right now, and particularly for New Year's, we need to remain careful. So just to repeat what I've said many times before, what you've heard many times before, protect your community, protect yourself, protect your family. If you love them, wear the mask over your nose and mouth. Don't disrespect their health. Show your respect for other people during this difficult time. We know that masks work. We absolutely know that. The science is undisputable. The coronavirus is here and the science is absolutely true about this. Stay 6 feet apart at a minimum. And if you're singing or shouting or in other ways projecting your voice, you actually should be more than 6 feet apart. You know, if you're just walking by somebody or running by somebody in the park, you know, that's not the end of the world. But when you're standing around with somebody, they talk about 15 minutes. Don't stand around with somebody talking with your mask off. Keep your social distancing. Keep yourself safe. Once again, the science is unmistakable. Keeping distance from people will slow the spread of this disease, and it will protect you. And in turn, because if you're protected, your family will be protected. And finally, wash your hands. This virus can spread by surfaces that are touched, and you shouldn't be touching your face or your eyes with your hands. But if you wash your hands frequently, and one of the things that I do is that every time I leave my office, every time I leave my home, the moment I come back to my office, the moment I come back home, I'm washing my hands very diligently. Those 3 things, and the last, don't go to large gatherings or parties. And it's not a scientific thing, it's just common sense at this point. We know that we've seen so many explosions of cases where a large group gets together and one person has coronavirus and the next thing you know, 5 people have it, or 12 people have it, or 20 people have it. Let's go into this new year safe. And I thank all of you who work so hard to protect this community, whether you're the first responders of our own people, whether you're working on the ambulance drivers or the healthcare workers and the nurses, or whether you're the fire department that's responding to emergencies, the police department. Thank you all for being out there, and thank you to all the healthcare workers at the hospital and out there in private practice who are protecting themselves and others. Let's all do our part to protect not only ourselves, but those who are giving so much and risking so much to protect us. Let's all do the same. And with that, somehow figure out how to enjoy the New Year's Eve. I'm not going out. I am going to look at the Stamford Symphony is having a brass New Year's celebration on Zoom on Sunday. And there are other events that we can do on Zoom. And while I'm a little tired of Zoom, I don't want to learn about coronavirus firsthand. So to everyone, you have a safe and wonderful holiday. Let us have joy, health, and a recovered prosperity in the new year. Thank you so much for listening, and good night.